Specific phobias. Specific phobias are a type of anxiety disorder in which an individual experiences excessive and persistent fear or anxiety about a specific object or situation. The fear is often irrational or disproportionate to the actual danger posed by the object or situation, and can lead to avoidance behavior. Some common examples of specific phobias include fear of heights, animals, such as spiders, snakes, or dogs, flying, enclosed spaces, blood or injections, and public speaking. Specific phobias can develop at any age, but they often begin in childhood or adolescence. What are the symptoms of specific phobias? The symptoms of specific phobias can vary from person to person, but they generally involve intense and persistent fear or anxiety in response to a specific object or situation. Some common symptoms of specific phobias include excessive and persistent fear or anxiety. This is the primary symptom of a specific phobia. The fear or anxiety is often irrational or disproportionate to the actual danger posed by the object or situation. Avoidance behavior. People with specific phobias often go to great lengths to avoid the object or situation that triggers their fear or anxiety. Physical symptoms. When faced with the object or situation that triggers their phobia, people may experience physical symptoms such as sweating, trembling, rapid heartbeat, shortness of breath, or nausea. Panic attacks. In some cases, the fear or anxiety associated with a specific phobia can trigger a panic attack, which involves sudden and intense feelings of fear or discomfort. Impairment in daily life. Specific phobias can interfere with a person's ability to function in daily life. For example, someone with a fear of flying may avoid traveling, which can impact their ability to work or maintain relationships. Not everyone with a specific phobia experiences all of these symptoms, and the severity of symptoms can vary from person to person. If you're experiencing symptoms of a specific phobia, it's important to seek help from a mental health professional. What causes specific phobias? The exact cause of specific phobias is not fully understood, but it is believed to be a combination of genetic, environmental, and learned factors. Genetic factors. Research suggests that specific phobias may run in families, suggesting that there may be a genetic component to the development of these conditions. Environmental factors. Traumatic experiences, such as being attacked by an animal or being involved in a car accident, can trigger the development of a specific phobia. Additionally, ongoing stress or exposure to stressful situations may contribute to the development of a specific phobia. Learned behavior. People may learn to develop specific phobias through a process called classical conditioning, where they associate a particular object or situation with a negative experience. For example, a person who is bitten by a dog may develop a phobia of all dogs, even those that are not likely to be aggressive. Cognitive factors. Some people with specific phobias may have underlying beliefs or thought patterns that contribute to the development and maintenance of their fears. For example, a person who has a fear of flying may have beliefs that flying is dangerous or that they are not in control while on a plane. It's important to note that not everyone who experiences a traumatic event or has a genetic predisposition will develop a specific phobia. Additional research is needed to fully understand the complex factors that contribute to the development of specific phobias. Specific phobias are typically diagnosed by a mental health professional, such as a psychiatrist or psychologist, who will evaluate a person's symptoms and medical history. A diagnosis of specific phobia will be made if the person meets the criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders, or DSM-5, which is a manual used by mental health professionals to diagnose mental health disorders. How are specific phobias treated? There are several effective treatments for specific phobias. The choice of treatment will depend on the severity of the phobia and the individual's preferences. Exposure therapy. Exposure therapy involves gradually exposing the person to the feared object or situation in a safe and controlled manner, while providing support and guidance. This can help the person learn to tolerate the fear and anxiety associated with the phobia, and over time, the fear response may become less intense or go away altogether. Cognitive behavioral therapy. CBT is a form of therapy that focuses on changing negative thought patterns and behaviors. It can be used to help people with specific phobias identify and challenge their underlying beliefs and fears about the phobia, which can reduce anxiety and increase feelings of control. Medication. Anti-anxiety medications or beta blockers may be prescribed to help manage the symptoms of specific phobias. However, medication is typically used in conjunction with therapy, rather than as a standalone treatment. Mindfulness-based interventions. Mindfulness-based interventions, such as meditation and relaxation techniques, can help reduce the symptoms of specific phobias by increasing relaxation and decreasing anxiety. Self-help strategies. Self-help strategies, such as deep breathing exercises or visualization techniques, can be effective for managing mild to moderate symptoms of specific phobias. For most people, specific phobias can be successfully treated with therapy, medication, or a combination of both. While it is not always possible to prevent specific phobias from developing, early intervention and treatment following a traumatic experience, such as an animal attack, may prevent the person from developing a severe anxiety disorder. Seek help from a mental health professional to determine the most appropriate treatment for your specific phobia. With the right treatment, it is possible to manage and overcome specific phobias.